Hello, my dear students. I welcome you all to this Anesthesia NEET-PG recall session by MedAce. I am Dr. Ganpathy Hegade and I congratulate you all for successfully completing this year's NEET-PG exam. I'm sure most of you faced a lot of challenges and hurdles. Despite that, you have done well in your exams and the success is just few steps away. So let me begin this session with a disclaimer. This session is purely based on your recalls and your inputs. Some of you have told me that the exam was very lengthy and you found it difficult to manage time. This was mainly because around 70 to 80 case scenarios were asked, all of them integrated across various subjects, and they had a lot of images, especially from radiology, which was new to many of you. So, the first question for the day is: a young patient undergoing upper limb surgery under general anesthetic suddenly develops tachycardia, hypotension, and arrhythmia. So, what could be the agent causing this? The options given were halothane, propofol, sevoflurane, and nitrous oxide. So, friends, in this session, we are going to discuss anesthesia as well as related topics, and we'll try to have different versions of the same question. This is mainly to improve your knowledge and grip over the subject. So, coming back to the question, so in this question, arrhythmia is a keyword. So, as you know, halothane is known to cause a lot of cardiovascular side effects, including tachycardia, hypotension, and triggering arrhythmias. Okay, so the arrhythmia is a keyword. Therefore, the answer for this question is halothane. Other agents like propofol and sevoflurane can cause hypotension, and sevoflurane and nitrous oxide have minimal impact on the heart rate. Therefore, they are ruled out. And the correct answer here is halothane. So, the same question can be modified and asked in this manner. After general anesthesia, patient undergoing surgery develops sudden rise in temperature with tachycardia and hypertension. Remember, not hypotension, it's hypertension and muscle rigidity. So, which of the following agents could have triggered it? The options here are etomidate, halothane, ketamine, and propofol. So, again, my dear friends, the answer here is halothane, because this looks like a trigger of malignant hyperthermia, and inhalational agents like halothane are known triggers of MH. So MH, as you know, is a life-threatening condition that gets triggered by usage of certain anesthetic agents like inhalational agents or succinylcholine. It leads to a hypermetabolic state characterized by hyperthermia, tachycardia, hypertension, and muscle rigidity. So the other agents mentioned in the question are not a known trigger. So the answer is halothane. Coming on to the next question, which of the following agents used for reversal of muscle relaxation produced by Vecurone? So, dear friends, I have mentioned repeatedly in the regular classes as well as in the prepathon session that Sugammadex is a very important agent for both reversal of muscle relaxation produced by vecuronium and rocuronium, as well as for your exams. So the answer for this question is Sugammadex. It specifically targets the neuromuscular blockers, that is aminosteroid type of neuromuscular blockers, namely rocuronium and vecuronium, and it binds to them and it reverses the blockade. So the answer for this question is Sugammadex. So the next question is, about 1 gram of EMLA cream was applied before IV cannulation of a child. Following are true about the EMLA cream except. So they are asking you which of the following is not true. So the statements given are: it contains lignocaine and bupivacaine. 5% of the cream has 25 milligrams of lignocaine. It's a eutectic mixture of local anesthetics, and methemoglobinemia is a side effect. So, as I mentioned in my previous classes, EMLA cream contains lignocaine and prilocaine, not bupivacaine. So the answer for this one is A. Okay. So again, let's recall some important concepts of EMLA cream. EMLA cream, it's a abbreviation for eutectic mixture of local anesthetics. It contains lignocaine and prilocaine. It does not contain bupivacaine. In a 5% formulation, there will be 25 milligrams of lignocaine and 25 milligrams of prilocaine each gram. So around 1 to 2 grams of the cream is applied about 30 to 60 minutes before IV cannulation. It produces good topical anesthesia for IV cannulation, and it is commonly used in children. So it can cause methemoglobinemia. It's because of the prilocaine component. So the answer for this question was A. So we had a circuit that was asked in the exam. So according to you guys, they had asked a modified version of Mapleson D circuit, and they had given its features, and had asked which of the following correctly describes it. So the modified version of Mapleson D system shown in the image features which of the following characters. So the options are a coaxial limb with narrow bore inside the corrugated limb and APL valve pressure setting of 10 to 20 centimeters. The second option is a non-breathing design with separate fresh gas flow, a system equipped with high efficiency carbon dioxide absorber, and a standard Mapleson C type limb without any additional features. Dear friends, I think the examiner is looking at Bain circuit here, and among these sentences, the first sentence correctly describes it. Bain circuit has a coaxial limb that delivers fresh gas through the narrow bore within the corrugated tube. So there is a small green tubing that is inside the corrugated tube, which brings the fresh gas, and the expired gas goes out through the outer corrugated tubing. So it's a modification of Mapleson D system, not Mapleson C. So the answer here is A. Remember, there is a APL valve that is designed so that it allows controlled release of excessive gases. So the next question was on capnograph. So I have given two variations of the question. So the first question is, in the normal capnograph shown below, what does the phase between points A and B represent? So what are the points A and B here? So this is A and this is B. So they are asking us, what does this segment correspond to? So the options here are alveolar plateau, end tidal carbon dioxide, expiratory upstroke, and respiratory baseline. Guys, if you can recall from our previous classes, capnograph is an important topic for your exams, and a normal capnograph tracing has following phases. So initially there is a respiratory baseline followed by expiratory upstroke and a alveolar plateau, and we take the EtCO2 measurement at this point where the CO2 comes from the alveoli, and this is the inspiratory downstroke. So they have asked us this segment, so it corresponds to the respiratory baseline. So remember one more important concept, that is alveolar plateau. Alveolar plateau gives us the recording from the alveoli. So in this phase, usually the carbon dioxide that is being measured is constant because it is measuring the carbon dioxide from the alveoli, and at the end of it, just before the inspiration, we take the EtCO2 measurement. So a similar question can be phrased like this. So what does the phase between point A and B suggest? So this is point A here in this image and this is B. So as I said earlier, this part corresponds to the alveolar plateau. Here the CO2 concentration is relatively stable as the gas is coming from the alveoli. So the correct answer being alveolar plateau. So they had asked this image and they had asked you to identify it. So the airway management tool shown in the images: endotracheal tube, nasopharyngeal airway, oropharyngeal airway, and uncuffed ET tube. So this we have discussed in our prepathon session as well as in the main class. So this is nothing but a nasopharyngeal airway. So let me show you other equipment. This is the uncuffed ET tube. This is the normal ET tube, cuffed endotracheal tube. This is oropharyngeal airway and this is nasopharyngeal airway. So the answer for this question is nasopharyngeal airway. There was one question on ambu bag. They had specifically asked about the pop-off valve in the ambu bag. So the question was, pop-off valve in the manual resuscitator or the ambu bag, which is designed to prevent excessive pressure during ventilation, when does it get activated? Okay, so the pressures given were 15 to 20 centimeters of water, 20 to 25 centimeters of water, 30 to 40 centimeters of water, and above 40 centimeters of water. So in my classes I had mentioned that this is a safety feature to prevent barotrauma that is inbuilt in the manual resuscitator. This is quite useful when the resuscitation is done by untrained professionals. They may tend to push in more air and that can lead to barotrauma, and to prevent that, the pressure is usually set at a level of 20 to 25 centimeters of water, which opens the valve, preventing any barotrauma. So pop-off valve in the ambu bag is set to release excess pressure around 20 to 25 centimeters of water. It's a safety mechanism that prevents overinflation of the lungs and potential lung injury like barotrauma. So the pressures above 40 centimeters of water are considered very high and there is increased risk of barotrauma with such pressures. So the answer for this one is 20 to 25 centimeters of water. There was a question on positioning for endotracheal intubation. So this I've told repeatedly in my sessions that it's an important aspect when you are intubating a patient. So when you are intubating a patient, you are going to make the patient lie down on a flat surface with flexion at the cervical spine and extension at the atlanto-occipital joint. So this makes the neck extended. Okay, so this is a simple question that I projected here. What is this position used for? Endoscopy, endotracheal intubation, NG insertion, and tracheostomy. Of course, this is used for endotracheal intubation. Okay, so this position is known as the sniffing position. It actually aligns the oropharyngeal and laryngeal axis into one. So that makes it an ideal position for endotracheal intubation. This enhances the view of the glottis during laryngoscopy and it facilitates easier and safer intubation. So the answer for this question was endotracheal intubation, and they can ask the question in this manner as well. So identify the ideal position for intubation. So the options: supine with neck extended, lateral with head elevated, prone with head turned, and sitting upright with head forward. So supine with neck extended is the answer. Okay. Yes. So you can use sitting with head forward for NG insertion. This was also asked in one of the NEET-PG exams long back. So the next question was on recovery position. Can you identify the recovery position from the below? So it's a left lateral recommend position, prone position, right lateral recumbent position or supine with head tilted backward. Which of them is right? Any guesses? Yes, the recovery position as shown in this image is a left lateral recumbent position. It helps to maintain the airway open and it prevents aspiration of vomitus or other fluids in unconscious patients. So remember, we are going to use this recovery position in patients who are unconscious but who are breathing. Okay, this is useful especially after the patient returns to ROSC following CPR. Okay, and it is not appropriate for patients who are not breathing or who don't have a pulse and require immediate CPR. So the questions so the answer for the question is left lateral recumbent position. Okay, so the variant of this question could be the recovery position is most appropriately used for which of the following situations. Okay, can it be used for a patient who's unconscious but breathing, or a patient who has no pulse or not breathing, or a patient who is conscious and breathing, or a patient who's conscious but not breathing? So, any guesses, my friends? Yes, the answer is a patient who is who is unconscious but breathing. So, as I said during the discussion, the recovery position is ideal for patients who are not conscious, have a pulse, and have good breathing. So there was a question that was asked in which they had shown an image of upper limb and some injection being given, and they had asked which block does it show. So there can be two interpretations to this. So this is the first variant. The image shows lignocaine injection being administered into the upper limb. Which of the following type of regional anesthesia is most likely being performed? Is it axillary block? Is it Bayer block? Is it subclavian block? Or is it wrist block? Okay, so if you can look at the image closely, they have applied a tourniquet here and they're trying to inject lignocaine injection through this butterfly here into IV, into a upper limb vein. So probably they're trying to demonstrate Bayer block here. So in my classes, I had mentioned that August Bayer was uh, one of the first people to give a spinal anesthetic. Also, he was the first person who designed this Bayer block for upper limb surgeries. It involves injection of lignocaine into the upper limbs. Before that, the limb is isolated by applying tourniquet over the operating limb, and the blood is exsanguinated, and the veins are filled with solutions of lignocaine and other local anesthetic mixtures. So this is a very painful block for the patient to experience. Uh, and one of the patients in whom we were trying to demonstrate this block during my post graduation, the patient actually ran away. It's a very painful rudimentary block that is no longer practiced anywhere. Okay, this is just for academic purposes only. So they could have asked this one, or they may have asked this question where the local anesthetic is being injected near the wrist block. So the question is, image shows lignocaine injection being administered around the wrist joint. What type of regional anesthesia is mostly being performed? So for this question, the answer should be wrist block. So just try to recall what they had asked. Also, based on where the injection is being administered, the answer will change. So, as you are aware, the wrist block is a popular block used for surgeries of hand and palm. It can be used for surgeries like carpal tunnel release or release of a trigger finger. So, the next question is compression of which of the lumbar nerve root would most likely result in pain radiating down the posterior thigh. So this sounds like sciatica. As you are aware, sciatica can happen because of compression of nerve root from L3 to S1. Okay, but they're specifically saying posterior thigh. So for this, we need to have the knowledge of dermatomes. Again, this is overlapping with orthopedics and anatomy. I think they're going to discuss it there as well. So they're saying the distribution along the posterior aspect of the thigh. So this part. Okay. So what they're trying to tell us is the pain distribution along the S1 dermatome. So the pain radiates down the posterior thigh and into the calf and foot. Okay. So the answer for this question is S1. So involvement of L1 and L2, patient can have anterior thigh involvement, and in L5, lateral aspect of leg may be involved. So the next question is, what is the recommended dose of adrenaline for a child during cardiac arrest? Again, guys, we have discussed this in the basic life support topic, as well as I have discussed this during the INICT prepathon. So remember, guys, according to Pediatric Advanced Life Support Guidelines, that is PALS guidelines for CPR, we use lignocaine in a dosage of 0.01 mg per kg, and it is available as 1 is to 10,000 solution. Okay, so that is the recommended dosage in children. So there was another question on IV fluids. I think this will be discussed in surgery as well. They had given the label of a IV fluid that read almost like this. So there was sodium chloride, potassium chloride, and some lactate that was mentioned. So they had asked identify this intravenous solution used in resuscitation of trauma victims. So the options were normal saline, Hemacil, Hartmann solution, and hydroxyethyl starch. So looking at the contents, I believe this could be Ringer's lactate RL or the Hartmann solution. Hartmann solution is another name for Ringer's lactate. Okay, so that is the answer. So there was one question asked about ECG, and so this is the rhythm that was given. Okay, how does it look like? Okay, so it looks like a ventricular tachycardia. So what is the first line of management for a stable adult patient presenting with ventricular tachycardia? So the options given are adenosine, digoxin, dual anticoagulants, and synchronized DC version. So this we have discussed during defibrillation, my dear friends. So if the patient is stable adult patient, okay, you are going to cardiovert the patient. If the patient is unstable or pulseless, what you're going to do? You are going to give him defibrillation. Okay, so if the patient is stable, cardiovert. If the patient is unstable or no pulse, you're going to defib. Okay, so the answer for this question is synchronized DC cardioversion. So a different variant could also be asked like this. After 2 minutes of CPR, child's ECG shows following rhythm. It is showing ventricular tachycardia. So what is the next step in this case? So if it was an adult, what you are going to do? You are going to shock the, as soon as you see this rhythm, okay, you are going to shock. You are going to give defibrillation. But according to Pulse guidelines, in children, as soon as you see this, you are going to deliver the shock followed by CPR. So in adults, you are going to give the shock and you are going to immediately check the pulse, whereas in children, you are going to deliver a 2 joules per kg shock, that is defibrillation, followed by CPR and then reassess the pulse. This is a minor variation, but a significant one in terms of your exam. Okay, yeah. So the answer is deliver 2 joules per kg of shock and followed by 2 minutes CPR and reassess the pulse. Okay, so the next question for the day is patient's chest x-ray is given below. Which of the following procedures will be difficult to perform in this patient? The options were endotracheal intubation, indirect laryngoscopy, nasogastric tube insertion and tracheostomy. So if you look at the x-ray closely, they're trying to tell us that the trachea looks deviated to right side here. Okay, so obviously in this patient it is going to be difficult to do the tracheostomy. So there was another x-ray and the scenario was a ventilated patient develops hypoxia and hypoventilation after 3 to 4 hours of ventilation with bronchi heard on the left side and chest x-ray reveals collapse of right lung. What clinical finding you are going to expect on the right side of the chest during clinical examination? Again, this is a overlap question with general medicine. So the options given are hyperresonance on percussion, decreased breath sounds, increased fremitus and pleural friction rub. So what do you expect here? Of course, on the collapsed lung, you are going to hear no sounds or decreased breath sounds on the right side. Where do you see the hyperresonance? So the hyperresonance is seen in pneumothorax, and in consolidation, you are going to see increased tactile local fremitus, and in pleuritis, you are going to see pleural friction rub. So the answer for this MCQ is decreased breath sounds. And we are at the end of this discussion. This is the last question for the day. Positive end expiratory pressure, that is PEEP, it is primarily used in mechanical ventilation for what reason? So the options are increase the respiratory rate, to reduce the ventilator requirement, to prevent atelectasis, and to decrease the tidal volume. So the answer here lies in the definition of PEEP. What does PEEP do? Positive end expiratory pressure is used to keep the alveoli open at the end of expiration. So, by keeping the alveoli open at the end of expiration, it prevents the atelectasis and thereby improves the oxygenation. Therefore, the correct answer here is to prevent atelectasis. So, that's it, my friends. Those were some of the recalls from the subject of anesthesia. I advise you can come back to our website by subscribing and you will get all the INICET and NEET-PG related updates on this site. I also urge you to download the MedAce app if you are planning for another exam like INICET. I tell you, I also request you to follow us on our Instagram page as well as all other handles. The MedAce app, it will help you with all the preparation content you need. All the notes we provide are very concise and clear. And just like this NEET PG exam, all our question banks are designed by our own faculty, and we have plenty of case scenarios that will help you deal with such clinical scenario based exams in future. We also have a lot of practice tests and a very good question bank. We have a lot of AI features as well. So I urge you to download this app right now and do tell it to your juniors so that they can benefit as well. Thank you.